look for a better position for this camera of mine. I don't know if that is the best. Yeah. Okay. Okay, guys. How are you? Hope you guys are doing good. Okay, today I want us to have a session on mental illness. And what is mental illness? Yeah, it includes a wide range of thinking, emotions, and behaviors. Okay, it can either be short-lived or long-term. Yes, at times it can be hard to tell the differences between the mental illness and the normal worrying or sadness. But mental illness is more severe, it lasts longer, and significantly affects a person's ability to cope with life. Okay. Okay, and almost 50% by the half of the people or adults experience these symptoms of mental illness at some point in time. Yeah, so yeah, depression is real, guys. It's very real. Yeah, and the main treatment for this illness is medicine and counseling. Okay. So we usually call it counseling. We usually call it talk therapy. Okay, and what I usually advise most of my clients is to first seek guidance or counseling. Okay, or the talk therapy before they proceed to a medical support. Okay, so ensure you first work with the talk therapy, but when it exists, then you can seek the medical support. Yes, guys. So family members, friends, and also support groups can assist you also cope with this kind of illness. Okay, so types of mental illness: we have anxiety. We have anxiety is whereby you feel kind of unease, you have some fear and restlessness. Yes, and some tension. Okay, so that is a type of mental illness. Yeah, anxiety. We have mood disorder. Yeah, mostly known as bipolar. This is whereby at times you're sad, you're depressed, at times you're excited. Call it mania. And yeah, it's also a disorder. We have schizophrenia. That one is usually very hard for me, so kindly understand me. Yeah, hapa itabidi tumeelewana. This word is never simple when it comes to me. So this one is a very serious illness and a mental illness, and it affects a person's it affects how a person thinks, feels, and behaves. Okay, we have another one called personality disorder. This is whereby there is a immediate there is a different changes in behavior. Yeah, how do I put it? It's a change. It's unexpected. Eh? It's an unexpected change of behavior. Okay, yeah, let me just call it unexpected change of behavior. Yeah, from time to time. So it's long term. Okay, yeah, it's long time. From time to time there is change of behavior unexpectedly. Yeah, you just change. Yeah, there is obsessive compulsive disorder. This is it's whereby you have excessive thoughts or obsession on that leads to a repetitive behavior. Okay, so we also have there are also some like other disorders are like eating disorders, stress disorder, what do you call this suicidal. Yeah, is it suicidal? yeah, suicidal behavior. Okay, so let us look for causes of these mental illnesses. Okay, we have the inherited factors that come from the family. You have life stressors, for example, environment you live in, probably pressure from work and pressure from family or parenting. Yes, we have health problems that affect your brain. We also have many stresses such as losing a job, taking a divorce, taking too many drugs, and all that. There are also certain of there is this also cause there, yeah, that affects how do I put it, there are this certain health problem that affect a baby's brain, such as complications during birth or brain infections by either viruses. Yeah, so note that mental illness does not occur because of because people are lazy or irresponsible. No, it's not something that people do in purpose. Okay, kindly note that. Yeah, because there is a misconception about mental illness. Yeah, people are really misunderstanding this kind of illness, and that is not right. Okay, so symptoms, they are different, they are very different depending on the kind of problem you have. We have major changes in personality or behavior, especially when it happens for no good reason or for no clear reason. There is confusion. Yeah, when you have confusion, that confusion is a symptom that leads to, yeah, to that. Odd or disorganized thoughts, such as jumping from topic to topic, or answering simple questions with difficult, confusing answers. Yeah, inappropriate behavior, such as undressing on in public. Yeah, so seeing or hearing things that are not there, we usually call it hallucinations. Yeah, hallucination. Believing things that are not true despite a strong evidence to the contrary. We have extreme moods. Yeah, so how can some mental specialist tell if someone has a mental illness? Okay, it is usually through diagnosis. Okay, by either talking to a patient or that person who is unwell, or at times you seek or you seek help or talk to caregivers or family. Yeah, at times it becomes even harder to tell if someone has a mental illness when he or she has lost a loved one. Okay, because they all involve being sad. You understand? So the dividing line between the two is based on how severe the symptoms are. Okay, how long the symptoms last, and how much symptoms affect the ability to function, or your way of living. Okay, so in the past, people with mental illness were often placed in institutions or hospitals, but nowadays, proper care, people are more likely to live in live productively in the community, yeah, through support and help. Okay, so in case you have any mental issue, kindly feel free to ask for support. Okay, communicate. Okay, earlier, doing it early enough is the best way, yeah, to manage such kind of illness. Okay, so don't be afraid, speak out. Yeah, and through that, you're also going to learn, and you're going to get better. Okay, so thank you so much for your support. Kindly subscribe for more information and for more content.